You're watching Channel 7 Action News.
Tonight, a new laser therapy is promising to reduce pain, relieve inflammation, and restore relief to people suffering from pain. And we're joined right now in our studio by Dr. Ron Letterman and his patient, Brian Gerzib. And Brian, you have a very unique story to tell, and you're going to tell us about a new laser treatment that you're using on patients. But Brian, let's start with you, because you just ran the Boston Marathon this year, but you were injured before that, right?
I was. I hurt my back in a run workout in February.
So you were in excruciating pain, or?
Horrible pain.
Horrible pain.
Yeah, I wasn't walking very well at all.
And so basically you were going to be out of the Boston Marathon altogether?
Probably, yes.
And then you went in for laser therapy?
Yes.
And what happened?
I went in for 6 treatments, and by the 3rd treatment I was feeling relief, walking a lot better. The pain was subsiding, and after the sixth treatment, I was good to go.
Good to go, and ran the marathon and did all right.
Yes.
So, Dr. Letterman, I know laser therapy has been around, but not for this. So explain this new treatment.
Well, laser therapy has been around for 30 or 35 years. And we were fortunate enough to work with a company that designed a laser that coupled a pulsed laser with a fixed laser. It's called a multi-locked system, MLS Laser Therapy. And this laser has the amazing ability to decrease inflammation, swelling, and pain. So people like Brian, who were debilitated, was able to run a marathon 2 months after getting this treatment.
So basically, as long as you have, well, even if you need surgery, you can still have this therapy, right?
Yes, absolutely. There are many patients we have that are, well, first of all, let me back up.
Okay.
We treat patients with orthopedic conditions. Initially in our practice, myself and my partner, Dr. Kortowitz, were very conservative in the way we approach treatment. We, believe it or not, try and avoid surgery on all of our patients. And that way you can treat patients with anti-inflammatory medications, cortisone injections, physical therapy, and as a last resort, surgery. Well, now what we have is a new non-invasive treatment, this laser therapy, that has no known side effects, and it gets people better. We've had patients actually cancel surgery. But if for whatever reason an individual still needs surgery, you can have the surgery, and we found that the laser actually speeds up the healing process after a surgical procedure.
And you said you're actually helping a lot of local high school athletes who come in with injuries, right? And they would take a long time before they would heal, but this laser therapy is helping them. Explain, like, what kinds of injuries are people coming in with? We know Brian had a back injury, but what else are you seeing?
Correct. Well, Dr. Kortowitz is the team doctor for a high school, and any of the kids that go down on the football field with an ankle sprain, a knee sprain, a shoulder injury, if you get under this laser for just 3 short treatments, within a week of an injury, it is cutting down the healing time. Sometimes instead of 3 or 4 weeks getting better, within a week or 2 they're better. And of course, as a high schooler, they want to get back on the field and back in their sport very quickly. So for an acute injury, it is getting people better very quickly. For a condition like Brian had, a training injury, or golfers or tennis players with tendonitis, it gets the inflammation and the pain down, and they can get back to what they like to do.
Now, there's been a lot of research on this, correct?
There has. Now, with regular laser, there's been research, thousands of articles. With this new MLS laser therapy, it's been studied out of institutions like Harvard, where they take animals in the lab, they look at the cellular reaction to this laser. The bottom line is the cells absorb this light energy in such a way that it decreases inflammation, swelling, and pain, but it also has shown to increase the metabolism of the cells, which is why it is speeding up the healing process from surgery.
What about any risks?
The contraindications to the laser is performing the laser over the abdomen of a pregnant woman, over an area of known cancer, and over an open growth plate in a young child. Other than that, there is no known side effect, no harmful side effects, and it's basically, if you were to get a laser treatment, it's like taking a flashlight and waving it over your knee. You probably wouldn't feel anything, but the tissues are absorbing that energy in a very safe way.
And beginning to heal. 2 last questions. How many treatments do people need, and how expensive is this?
That's a great question. And it varies from each individual, which is why we recommend when patients call us, they come in for an orthopedic evaluation, either by myself or Dr. Kortowitz or one of our physician assistants, to determine what is the condition, how long have they had the condition, and patients are benefit from either a series of 3 short 8-minute laser treatments, 6, or 10. The 10 is for arthritic conditions that someone's had for more than 3 to 6 months. The cost is anywhere from $75 to $150 for a laser treatment.
Wow, so it sounds promising. So people should look you up if they're interested, correct?
Well, I appreciate that, but I'll tell you, it's really exciting. It's revolutionized the way we've practiced. I've been practicing 17 years, and to come into the office every day and know that I have something else to offer patients that really works, and Brian is a testament to that, is really, it's a wonderful thing.
And you're the only orthopedic surgeon really in the country doing this right now.
Right now.
Okay, and we want to let all